Former Prime Minister Liz Truss tabled a private member's bill on changing the law when it comes to defining biological sex. Now, yesterday, she outlined the details of her bill. Let's take a listen.
Sex means biological sex. It's the sex you are born as. That is how children should be treated until they're 18 and they're old enough to make their own decisions. And what it will mean is it will protect single-sex facilities like toilets, single-sex sports like girls' sports.
Also, amidst the debates over the use of puberty-suppressing hormones for children with gender dysphoria, the NHS in England has implemented a significant change in policy banning puberty blockers for under 18s, whilst the therapy has shown promise in alleviating distress for some individuals with gender dysphoria. It's rather nice, rather creative. I don't know why they did that. Concerns, I'm joking. Concerns persist regarding long-term impacts on bone density, brain development and cognitive function. So is it time? Is this the right decision? Joining me now is GP and medical writer, Dr Renee.
Hello.
Hoenderkamp.
That's fine. My patients call me Dr Renee.
Dr Renee, so is it the right decision?
Absolutely, it's the right decision. And frankly, Nana, it doesn't go far enough. Because it should actually ban these hormones from being prescribed by anybody. And by that, I mean the private clinics. So that's a loophole that exists. Lots of these children go via private clinics because the wait lists actually for the gender clinics are so long. And then they come to the NHS already established on them. And we've got doctors sitting in Spain prescribing for our children here and sending hormones by post. You know, it's a disgrace.
What is the obsession with this? Why can they not just allow the children to go through puberty, to acknowledge who and how they are, and then, at that point, if you feel like doing that, do it?
Well, the simple answer to that, Nana, is because the activists know that if they let children go through the natural process of puberty, which is what they're trying to stop, 90% of them will actually settle with their natural biological sex and be happy. Whereas if they go onto puberty blockers, 90% of them will go onto cross-sex hormones. So if you get them on the train early, they stay on the train. And then when they get into adulthood and they're actually unhappy with what they've done, it's too late.
But it feels almost like sort of grooming. I know it's not meant to be, but it feels like you're getting them onto a lifetime of medication.
Yeah.
Which
they can't understand. How can a 13-year-old understand the implications of a lifetime of medication, of surgery, of being infertile? You know, no 13-year-old can really understand the consequences of that, because only when we've been through puberty and we are women and men do we then even start thinking about fertility and children and whether it's something we want to add to our lives. And it is a form of grooming because lots of them are being groomed online. So the moment they hear this idea about maybe I'm in the wrong body, and lots of them are gay, and so then they start thinking, oh my God, I'm gay. They're still finding that really difficult to cope with. And, you know, if you speak to anybody, all my gay friends will say that it doesn't matter how open society is, it's still a really difficult decision to come to terms with. So they go online and they Google, am I really gay? They instantly get a trans website. They go on that and that's it. The algorithm starts and they start getting taken down the rabbit hole of you're not gay, you're just in the wrong body.
And the reality is there's not really any such thing as being in the wrong body, because your body is your body. So the body you're in is your body. You might feel that you should be in a different gender stereotype of your body. But it is ultimately a gender stereotype, isn't it? Because what you see when trans women sort of dress up to become what they feel is a woman, it feels often like a caricature or a stereotype of what a woman is.
The one that we've tried to actually get rid of over the years, because we've tried to tell women they can be whatever they want, and men. Absolutely, it's that. And, you know, that no child, let's be clear, Nana, no child is born in the wrong body. They're born in the right body. What they have, however, is lots of mental distress and trauma. So many of these kids have got ADHD, autism, depression, anxiety, or trauma, quite often sexual trauma. And what needs to happen is we need to step back, stop medicalising them, help them through this, explore gently what's underpinning their distress, because certainly they're distressed. But what we're doing now is we're experimenting not just on children, we're experimenting on vulnerable children. I truly believe this will be a medical travesty that we will look back on in 10 years' time like we do now thalidomide.
It's terrible, and the number of people who have gone through this process, and one in particular, Brianna Ivy, who's an American woman, and I will say woman because, you know, she's been through the whole thing, and I really seriously sympathise with what she's been through. So this is out of compassion, frankly, not because I believe that she is a woman. And in fact, when I spoke to her, she acknowledged that she's not a woman. She acknowledges that she's a man, and I have utmost respect for her. But she wishes that the adults had told her, stop, don't do this.
Well, I think it may even have been her I read that... I read someone who had transitioned said that when I was 13, I decided that I didn't want to be a woman. Oh, it's the other way. Before I even knew what it was to be a woman.
Yeah, a man,
Yeah, you know, so it's really unfair on these kids that adults are actually stepping out of the room and leaving them to it. Parents actually need to step up to the plate and actually take some responsibility and not be scared by the myths. Trans children do not kill themselves.
No. You're more likely to do it if you've gone through that and you can't go back.
And we now know that if we actually let them transition in any way, social, medical, surgery, they're not happier after it. So it's not solving the problem.
No, let children be children. Thank you so much.